working 12 hours for free just don't sit like right in my spirit. Like it get caught in my throat type of thing. Hello you guys, welcome back to another video. This video I am super excited to share with you guys, but first I wanted to say that my name is Sharday. I'm like already trying to jump into the video. First let me introduce myself. My name is Sharday. Welcome. I have been doing a lot of nursing content, and you guys, you can expect more from me for a very long time because I still have a year of my RN program to complete. I am a Block 2 student. I have about 2.5 weeks left of Block 2. I will be going into Block 3 in January. I am super excited to share this video with you guys, but before we get into this video, make sure that you give me a big thumbs up. Make sure that you hit subscribe and hit that post notification bell. That way you are notified when I post a new video. And also when you give me a thumbs up, it kind of helps the algorithm give it to other nursing students. So today's video, I am going to be talking about me completing my Block 2 clinicals. You guys, I did not do any clinicals Block 1 because of Miss Coronavirus. You do a lot of long-term clinicals. You do a lot of clinicals tailored to the geriatric and elderly population. And so we did miss that experience, which I wasn't too worried about or too flustered about because I do patient care 5 times a week as it is. And I work with the geriatric population. They're so cute. I love that population. But yeah, so Block 2, I had Psych and MedSurg. So I had my Psych clinical first. I actually had 2 or 3 Psych clinicals. I was at a inpatient psychiatric mental hospital. And you know, our instructor kind of went over what not to bring, sharp items, of course. Your insulated water bottles, bring plastic. Things like how to approach a patient. Don't necessarily have your hands in your pockets all the time. Be mindful of your body language. Excuse me. Psych is heavy on therapeutic communication. So we went over a lot of how to talk with people, how to get them to open up, how to, you know, suicide ideation was a huge one in Psych, whether it was for your mental status exams or whether it was for any type of drugs that could cause an increase in suicidal ideation. So we did a lot of that. Now during clinical, it wasn't a super duper long one, but basically this is what I thought going into my first like nursing school clinical. I'm like, okay, I'm gonna at least be with like maybe one other nursing student, and we're, you know, I'm gonna at least be with somebody that I know. That's what I at least thought, right? Wrong. My instructor pretty much dropped me off to the huddle, the nursing huddle, and was like, you know, hey, you know, this is gonna be your nursing student for the day. You know, let me know if you have any questions. I'm the instructor. And she was gone. And I was like, so I'm like, you know, everybody there is like, hi, how are you? What school do you go to? What block are you in? Blah, blah, blah. And I'm typically a very outgoing person. But I wasn't in my element. Like, this is the first time I've ever been in a psychiatric hospital ever, okay? So it's not like I have like experience with this type of care or anything. And I was just kind of really nervous and shy. But I had the sweetest nurse ever to just kind of like guide me. She had like a very calming, mothery kind of voice. And she just kind of showed me around. She was pretty new to Psych, I would say about 2 years into Psych. She came from MedSurg into Psych. She loved it. She loved Psych, okay, I should say. I think she was burned out from MedSurg, but she loved Psych. And she was just kind of telling me like, hey, look out for this. You want to, especially for the patients or clients, as they like to say, who are court ordered, which just means as they basically can't deny their meds. They can't deny like treatment or anything. So if they are denying it and they're not taking their oral meds, you do have to give them a shot of their medication, which sometimes will include restraints, which sometimes will include the BHTs, which are behavioral health technicians, kind of like CNAs for psychiatric hospitals. And they come in, and mind you, these are men who are strong, and some women too who are very strong, very assertive, but they are also so very kind to the people and the clients. And it was amazing to see the BHT's relationships with some of the people that were there for a while. They just know their triggers. They know what makes them smile. They know to go get them a piece of candy. You know, they just know certain things. So I wanted to spend some time with the BHT, even though I'm supposed to be focused on nursing stuff, right? Nursing interventions and meds and all this other stuff. But I was just super curious as to how to communicate with somebody who's mentally ill. Mind you, when you go into your psych clinical, you're going to see a lot of schizophrenia. Now, my instructor was very clear and adamant about, hey, this isn't as common as you may think. It just seems like there's a lot of schizophrenia because you're specifically in the hospital, okay? We also did a simulation where we would hear, like, we put on our headphones and we would hear voices, and we would try to, this was not at clinical, this was for another project, but we would try to answer questions that somebody was trying to tell us, or write stuff down and try to remember, and it was extremely hard. So this was to kind of put into perspective and be more empathetic of these individuals, because there's like, mental health is so stigmatized. I know that we're kind of bringing more awareness to anxiety, we're kind of bringing more awareness to depression, we're kind of bringing more awareness to suicide and PTSD and all of these things. But what about the schizophrenia? What about the ADHD? What about, you know, all of the personality disorders? What about all of those things? Like, these are still people too, and they need help as well, and they need help without judgment. They need help with empathetic caregivers and nurses. And it was just a beautiful experience to try to reprogram any past prejudices or anything like that. That's why I love Psych so much, because it opens your mind up and really helps you to not look at people and judge them. It really is like, hey, let me help you, you know, for your quality of life, okay? So just like a person that would be sick or with a broken arm or with a fever or, you know, with sepsis, you know, anything like that, just as real as that is for them and their pain, that is the exact same, you know, manifestation in an individual who is mentally ill. They are, I don't want to say equally ill, because one, it could be, well, I was gonna say one, you know, it really could be detrimental to their actual life, but the same with mental illness as well. Homicide ideation, suicidal ideation, you know, it's really important to bring more awareness to it, and to bring more nurses and healthcare providers and psychiatrists and psychologists and nurse practitioners. All of that is so important to our community, because you guys, I know that we always say that nurses are angels, but they really are angels in my mind and my heart when I see what they do for the community, okay? Even though it's a job, even though it's a career, it's beyond just clocking in and clocking out and doing what you need to do and going out, especially in a psychiatric kind of setting. You really have to think through things. You really have to ask the right questions. You really have to be mindful of what you're saying, mindful of what you're doing. And building trust is so important in those settings, okay? I'm so sorry that went on so long, but I feel like it was needed to say. Okay, now at clinical, I really didn't do a lot at clinical, okay? We sat behind like this clear not plexiglass, I guess you could call it plexiglass kind of nurses station, okay? And that's for when things escalate, that's for the nurses' safety and a whole bunch of other reasons. But the clients were able to come up to the sides and talk with us and, you know, ask for things. This hospital was very good about, you know, having cell phones and internet use for them, having headphones if they wanted to listen to music. Because I did, on my second clinical, I did get to have experience in the adolescent unit. Now that was very, very interesting and totally different from the adult unit. The adults are pretty much in their rooms, quiet, you know, kind of like okay with being by themselves, okay? And the adolescent unit, they were always playing with each other. They were always together. They had multiple group therapy sessions a day. And I sat through a few of those as well. During the group sessions, it was really interesting to see how the therapist, she was really trying to prepare them to be discharged, to say, hey, what do we do in this situation? What do we do if your friend tries to offer you drugs? What do you do if your parents don't like your boyfriend or girlfriend? What does that really mean? Does it mean that they're trying to be mean? Or does it mean that they're trying to keep you safe? Does it mean that they want you to be happy? Does that mean that they want you to, you know, not slack on your responsibilities? So she would give them practical examples, and she would also give them real life scenarios in a very simplified, easy to understand way. And I thought that that was absolutely amazing. The clients also had the freedom to enter whenever they wanted to, and they had the freedom to exit whenever they wanted to. And whenever they would exit, she would always stop and pause and ask, are you okay? And if they would say yeah, and they would just go get a blanket or a Gatorade or whatever the case may be, she was like, oh, okay, moving on. But she was always mindful of every single small little trigger in these children. And I thought that that was so amazing. Like, she truly was like, made me have such an interest in psych, the therapeutic aspect of it, of what it actually brings to people, because a lot of these people are coming from backgrounds, you know, abusive parenting, molestation, physical abuse, neglect. You know, everybody had their own story that would absolutely blow your mind. And so she was trying to teach them basic survival skills of, and you guys already know, being a teenager, being an adolescent is already hard enough, and you throw on an unstable, unhealthy, toxic home environment, it just makes it 10 times harder for these kids. So just being able to witness that was absolutely incredible. And I love that after every clinical, we had the opportunity to have this debriefing and really like think about what we've seen today, and how was it what we were expecting, was it not, what did we gain from it, what did we learn? And I was just blown away, you guys. I was just blown away. My heart and my support totally goes out to the people that are involved with taking care of the mentally ill, of the mentally disabled, and of people who just need a little extra love and care and support and a little nudge into the right direction. I love you. Thank you so much for your service. Okay, moving on. I'm not going to keep apologizing for how long this is, because clearly this is like, you know, when I do my reflection videos of like, I completed this, let me tell you about it, it's going to naturally be a little bit long because I'm condensing the entire semester into one video, and, you know, just trying to get all my thoughts out, because I don't like to write everything down, because then it's just whatever. Moving on. The MedSurg Clinical. That is a completely different ball game, okay? The MedSurg Clinical, we barely learned about anything before we were going into clinical. We have 3 12-hour clinical shifts. We also have some virtual simulations that we do. And with these clinicals, we have to chart, okay? Now, my first clinical day was amazing. So was my second. Okay, everything was amazing, okay? I love the hospital. The nurses were super sweet, super smart, so informative. They made everything a teaching point, and they also let me be hands-on with everything. I was taking IVs out. I was helping with catheters. I was helping with ileostomies. I was pretty much doing everything. And then I also incorporated my CNA skills. I was changing beds. I was giving showers, asking a lot of questions. I had to, basically we have to go in, see what kind of meds they're on, connect the dots, pull the meds, give the meds, know how to work the computer system, do a head-to-toe assessment, do a social history kind of assessment, ask a few questions, and then also be involved with the nurse as well. So this was a 12-hour shift, and it wasn't no getting out early on this one, okay? It was 6 to 6, and I was very tired afterwards. I was busy. I thought that I'm like, you know what, I'm gonna go home and study and, you know, do this, that, and the third because I have an exam on Wednesday and all this other stuff, right? No. As soon as you sit down when you get home, you're there. That's your spot. It belongs to you. I took a shower and that was it. That was all I could muster up. I tried to do a little bit of, like, I tried, but I never really got to the content. I maybe like opened my laptop and that was about it. So yes, you are very tired. So keep that in mind when you look at your calendar and you say, okay, I have a 12-hour clinical this day. I have this. I have work throughout the week. I have this going on, this project, this exam. Plan ahead. Do extra work on the days that you don't have anything going on. Make sure that you're studying prior to clinical, so that way afterwards, and maybe you have maybe 1 or 2 days before your exam after your clinical, that you're not like looking at this information for the first time. You're looking at it for the 3rd and 4th and 5th time, to where you can really solidify this information in your brain. Know that you're going to be tired, unless you're just so used to 12-hour clinicals. Even if you're used to 12-hour clinicals, because I did 12-hour clinicals as a CNA for 2 years straight. Even when you're used to it, you're familiar with it or whatever, it's still, you still have a lot going on. You still have these projects, you still have these exams, you still have 6-hour lecture days. You know what I'm saying? So even though you may be used to it, adding in that extra 12-hour shift on top of work, on top of school, and on top of all this other stuff, I was tired. And that is the reason why I'm tired right now, is because I've been doing it. I've been doing 2 clinical days for the past 3 weeks, on top of very long lectures, on top of working 6 days a week because I missed a day on Monday, you know, for a 12-hour clinical. So the days that I'm taking off of work, I'm still working, but free labor for 12 hours, okay? That's another thing. I said to my classmates, I'm like, something about working 12 hours for free just don't sit like right in my spirit. Like, it get caught in my throat type of thing. But you know, you got to pay it forward. You got to learn, you got to go in, you got to be hands-on, and definitely the people are watching you. Know that. Market, connect, build connections, do your best. Don't wait for somebody to tell you something. Every little thing. If you see that there's a need, if you see that there's a call out, if you see that a bed needs to be changed, if you see that a person needs help getting cleaned up and whatever, go do it, you know? Be an asset to your nurse for that day. They'll be more willing to open up, more willing to teach, more willing to have their personality come out, and for you to actually kind of get to know them as well, to where they can be a little bit more comfortable too, because just this random person you got to train. So yeah, that was MedSurg Clinical. Now, the charting aspect, I spent 4 hours charting on my first day of clinical, because when I tell you I spent so much time with my patient, I loved my patient. Oh my gosh, I loved her, okay? Maybe that's I don't know if that's gonna be a hindrance for me working in the hospital setting after graduation. I am such a big lovey-dovey, especially when it comes to the older population, the geriatric population. Oh my God, I love them so much. Like, I love them so much. So I'm very like, I don't know if that's gonna hinder me or not, or if it's like appropriate, but I absolutely loved her. I did everything that she wanted. Like, anytime that she needed something, her call light was answered right away. Like, you know, I totally attended to her, because we have to typically pick a patient to chart on. So sometimes you can become a little partial to one patient just because that's what you pick. So you really want to get to know them. You really want to get the information for your charting, you know, because this is a project. And this is also being reported to the state to make sure that we're meeting clinical requirements. And, you know, it just goes into your whole experience. So It took me 4 hours to chart because I had literally everything. I had her social history. I knew what they was doing at home. I knew about her husband. I knew about her daily activities. I knew about the decline from her condition. I knew, you know, I gave her a shower. I did all of this stuff. Like, I knew what she was doing for the holidays. I knew everything because I spent the time, I asked the questions. So I was putting in all of this information, you guys. Now, this is a pro tip. Whatever your instructor asks you to fill in, just do that. They just want to see that you know how to chart, that you know how to, like, not put your foot in your mouth, that you know how to chart facts and not your opinions, that you know where things are, like vitals and nursing notes and patient teaching, that you know how to teach a patient. And how do you evaluate that your patient was receptive to learning? Was your patient ready for learning? Like, you know, certain things like that. So this time, so my second clinical round, oh, mind you, like, I don't know what happened in the computer world, but that 4 hours of charting, poof, it was gone. Like, poof, it was gone. She didn't even see it. But I have learned a lot. I do feel like all of the reflecting, all of the thinking, all of the skills and all of the concepts coming together, I do feel like on block 2, I do feel like the block 1 concepts are coming together, and it's definitely harder. It's more application this go round. The questions are a little bit harder. I'm definitely going to be changing the way that I study because I feel like as a nursing student, your studying really should evolve, okay? It really should, because when you think that you know how to study, you really don't. Clinicals actually help a lot. It can be a little frightening at times. It can be very tiring at times. It can be kind of annoying at times. But when you are reading about something, learning about it on PowerPoint, testing on it, literally being consumed with content, and then you actually go and do it in the hospital, you're like, oh, it's actually not as complicated as I thought. Well, it's probably complicated, but in the nursing world, you know, starting an IV is actually not as complicated as I thought, type of thing. I love that aspect of it. It kind of like light bulbs you when you actually see stuff in real life. You actually see the vitals of a real person in real life, and you can actually apply things to a real life situation. So I absolutely appreciate that aspect of clinicals, you guys. So if you made it this far into the video, don't forget to hit subscribe. Okay, don't forget to hit that post notification bell. Give me a big thumbs up if you like these kind of reflection, completing certain aspects of nursing school kind of content. Thank you guys so much for supporting me. Thank you so much for following me on my journey. I definitely don't minimize any little part of my journey for you guys. I definitely want you guys to get a full-blown look into what to expect, what could be possibly different for you in your nursing program, and all of that good stuff. And that is all that I have for you guys today. Again, be blessed. You already know I love you. I tell y'all I love y'all every single video. Y'all know I'm a lover girl. Like, y'all know I'm certified lover girl, for real. Like, for real. Thank you for supporting me. I will see you in my next video. You guys stay encouraged. Hold on, because I'm tired, sis is tired, you tired. Everybody, he over there tired, the dog over there tired, everybody is tired right now, okay? And then we got the holidays coming up. It's just a little overwhelming. I'm not even worried about the holidays this season. It's just getting tired, okay? But we are doing this. Like, we are doing this. We are having a positive attitude. We are still chugging along. We're holding on to our faith. We're spreading love. We're spreading positivity. And it's giving nursing student, you know what I mean? Like, we full-blown hustlers out here, okay? Nursing students are hustlers, okay? So I will see you guys in my next video. Take care. Have a good day. Have a good week. Whenever you see this, I love you. See you later. Sunlight that always stays, dinner by the waterway. It's that sweet life. Raise your cross. Made some dude crack a smile. He asked if I could stay a while.